Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on hernia. A hernia usually happens in your abdomen or groin when one of your organ pushes through the muscles or tissues that contain it. It may look like an odd bulge that comes and goes during different activities or in different positions. It may or may not cause symptoms such as a discomfort or pain. Most hernias will need surgical repair. It might be umbilical hernia or a inguinal hernia or femoral hernia. What is a hernia? Hernia occurs when the part of your inside bulges through an opening or weakness in the muscles or tissue barriers that contains it. Most hernias involve one of your abdominal organ pushing through one of the walls of your abdominal cavity. Hernias can occur gradually as you get older and regular wear and tear on your muscles begins to add up. And they can also result from an injury, surgery or birth disorder. What are some common hernial locations? You may get a hernia in your lower chest through your diaphragm, which is diaphragmatic hernia, or if you grind through your lower abdominal wall, which is a inguinal hernia, along with the front of the midline of your abdomen, which is epigastric hernia, or through a former abdominal surgery, incisions such as Ventral incision surgery, which is given during the lower segment cesarean section. So it is more common in women, and sometimes when you have a surgery on intestine, stump is formed, so you may get hernia after abdominal surgery. Any laparotomy, if being done before for cholecystectomy or for intestinal perforation, then you might get later on in your life surgical hernia, incisional, which is called as incisional hernia. What are some of the different types of hernias? Specific types of hernias include inguinal hernia. Inguinal hernias are the most common type, accounting for 75% of all hernias, and they mostly affect men or people assigned male at birth, and they happen when part of your bowel protrudes into your inguinal canal, a passageway that runs down your inner thigh. Then the second one is femoral hernia. Femoral hernia is a less common type of groin hernia that occurs in the femoral canal, which runs underneath the inguinal canal. Fatty tissues may poke through it. And then is the hiatal hernia. A hiatal hernia is another common type of hernia that you acquire during your lifetime. It happens when the opening in your diaphragm, when your esophagus passes through, widens and top of your stomach pushes up through the opening into your chest. Then is congenital diaphragmatic hernia. Congenital diaphragmatic hernia is a serious birth defect in which the diaphragm does not close all the way during fetal development. It can cause abdominal organs to slip into the chest cavity while the organs are still growing, crowding the lungs. And then there is maybe incisional hernia. Incisional hernia occurs when tissue protrudes through a former incision in your abdominal wall that weakened over time, and it is a common side effect of abdominal surgery. Then might be umbilical hernia. An umbilical hernia occurs when part of your intestine pokes through an opening in your abdominal wall near your belly button, and most umbilical hernias are congenital, present from birth, and they may subside with the passage of time in early childhood by the age of 2 years or 18 months. Then there may be ventral hernias. A ventral hernia is any hernia that occurs along the vertical midline of your abdomen. It includes umbilical hernias and many incisional hernias, and epigastric hernia is a ventral hernia above the belly button. Then there may be perineal hernia. A perineal hernia occurs when organs or tissue pushes through an opening or weakness in your pelvic floor into your abdominal cavity, and these hernias are relatively rare. So what is the Perineal hernia. A perineal hernia occurs when organs or tissue push through the pelvic floor muscles into your abdominal cavity, and your risk of perineal hernia is greater after pelvic surgery, and injuries and pregnancy also causes this type of pelvic floor hernia. It may be painful to sit, and surgery is required to treat the perineal hernia. What is perineal hernia? Perineal hernia occurs when weak pelvic floor muscles allow part of an organ or tissue to push into your abdominal cavity, and this type of pelvic floor hernia can be a rare complication of the pelvic surgery. It can also develop after an illness or injury, and less commonly the condition is present at birth or congenital. You may better understand this condition when you break down the meaning of each word. Perineum refers to your perineum, the areas of skin between your anus and the outer part of your genitals. And in the male reproductive system, this is the scrotum. In the female reproductive system, it is the vagina. And the hernias often occur when part of an organ or fatty tissue pushes through a weak area in muscle or fascia. Fascia is a fibrous connective tissue that holds muscles, organs, nerves, bones, and blood vessels in place. Your muscles and fascia are part of your musculoskeletal system. What are the types of perineal hernias? Healthcare providers classify perineal hernias as into three categories: acquired, occurring after an injury, illness, or pregnancy; then congenital, which are present at birth. This type is very rare; and the secondary, occurring after surgery, which is a post-operative surgery. Hernias are common and they can affect all ages and sexes. Inguinal hernias, which allow part of your small intestine to push into your groin area, are the most common. Approximately 1 in 3 Americans, most men and people assigned male at birth, will develop an inguinal hernia at some point in their lives, and in comparison, perineal hernias are very rare. They occur in about 0.34% to 7% of people who undergo pelvic surgical procedures. And women people assigned female at birth, AFAB, are more likely than men and people AMAB to develop this type of hernia. Perineal hernias occur when damage to the muscle or the fascia in your pelvic floor causes the tissue to stretch or weaken. Injuries, illnesses, pregnancy, and major pelvic surgeries can cause this damage, and your pelvic floor is a group of muscles that support organs in your pelvis, including your bladder and rectum. It also supports the prostate in men and people AMAB, or the uterus and vagina in women and people AFAB. You are most likely to develop a perineal hernia after pelvic surgery that takes place through a large incision in your abdomen. This type of open procedure often involves cutting or stretching a large amount of muscle and tissue in your pelvic floor. After surgery, your muscles and tissues are weaker. This can increase the risk of an organ pushing through the pelvic floor, and perineal hernias tend to occur within 6 months to 5 years of pelvic surgery. You are most likely to develop a secondary perineal hernia after undergoing certain surgeries such as abdominoperineal resection. This is a procedure to treat rectal cancer or anal cancer. It involves removing your anus, rectum, and part of your large intestine called the sigmoid colon. And you may have a laparoscopic abdominoperineal resection, and this surgery takes place through several small incisions. An open abdominal perineal resection involves one large abdominal incision, and both procedures increase your risk of perineal hernia. And low anterior resection, prostatectomy. This surgery removes all or part of the cancerous rectum through an incision in your lower abdomen, and this surgery is also a treatment for inflammatory bowel disease. Prostatectomy. Then is the pelvic exenteration. This surgery removes your rectum as well as nearby organs like your bladder, prostate, or uterus. And in addition to rectal cancer, the surgery treats prostate cancer in males and females. Pelvic exenteration also treats cervical cancer, uterine cancer, vaginal cancer, and vulvar cancer. These factors increase your risk of perineal hernia, such as being a woman or a AFAB, and cancer treatment like chemotherapy and radiation therapy, and with the history of smoking, and if you have a hysterectomy, rectal tumors, or cancers, or if you use immunosuppressants. Or what organ does a perineal hernia affect? After a trauma or surgery, one or more parts of your organ may push through pelvic floor into your abdominal cavity, such as bladder, large intestine, omentum, a layer of fat that covers your intestine, liver and stomach, and small intestine and uterus. What are the types and what are the symptoms of perineal hernia? Some people with perineal hernias don't have symptoms. Others have pain or discomfort when sitting. Additional symptoms of perineal hernia include difficulty peeing or pooping, pulling sensation or discomfort when standing, small bowel obstruction or large bowel intestinal obstruction, swelling in one buttock cheek, and diagnosis and test. How your healthcare provider may be able to feel and see the bulging of hernial sac. You may also get a CT scan or MRI to confirm the diagnosis. You will need surgery to put the protruding organ or tissue back into the place, and your surgeon will stitch together the weakened muscle or fascia, and they may also sew a synthetic mesh material or a muscle flap into your pelvic floor to better support your organs. Surgical options for hernias include laparoscopy using a thin-scope device with a camera laparoscope and several small incisions, robotic surgery using laparoscopy and a robotic device, transabdominal through a transabdominal incision at the site of the hernia, and transperineal through a small incision in your perineum. What are the preventive measures? Doing Kegel exercises, pelvic floor exercises can help strengthen your pelvic floor muscles, and the surgeries that can cause a secondary perineal hernia are medically necessary and often life-saving. After surgery, it's important to follow your healthcare provider recommendation about resuming activities and lifting heavy objects. These steps may lower your chances of developing a hernia. Now we would come to inguinal hernia. An inguinal hernia happens in your groin in a passageway called the inguinal canal. You might see a bulge on one side of your pelvic bone. It is caused by abdominal tissue pushing through an opening in your lower abdominal wall. The opening may be congenital, present at birth, or due to the normal age-related muscle degeneration. So an inguinal hernia is when abdominal tissue like belly or fat or a loop of intestine bulges through an opening into your lower abdominal wall. So hernia occurs when the tissue from one body cavity bulges through an opening in your muscle wall into another, and inguinal hernias are the most common type of hernia. They happen when abdominal tissue such as belly fat or a loop of intestine bulges through an opening in your lower abdominal wall. This is the wall that separates your abdomen from your groin. Inguinal hernias occur in the inguinal canal, and which is a passageway that runs down either side of your pelvis into your sex organs. They are also called groin hernias. Inguinal means in the groin. They are the most common type of groin hernias, though not the only one type. Less common are femoral hernias, which happens in the smaller femoral canal that runs underneath the inguinal canal. What's the difference between a direct inguinal hernia and an indirect inguinal hernia? Suppose first we will talk about the direct inguinal hernia. A direct inguinal hernia penetrates directly through the wall of your inguinal canal, and this type of hernia occurs in adults over time from a combination of weakening abdominal muscles and chronic pressure on the muscle wall. And then we would come to the indirect inguinal hernia. An indirect inguinal hernia enters your inguinal canal through the top, and this usually occurs because of a birth defect. In some fetuses, the opening to their canal does not close all the way during development in the uterus. And by birth defect is something visibly abnormal, internally abnormal or chemically abnormal about your newborn baby's body. The defect might be caused by genetics, infection, radiation, or drug exposure, or other might be not known to any reason. Examples of birth defect might include phenylketonuria, sickle cell anemia, and Down syndrome. Then we would come to hiatal hernia. A hiatal hernia is a condition where the top of your stomach bulges through an opening in your diaphragm, and this can happen to people of any age and any gender. Hiatal hernia does not always have symptoms, but when it does, then they are similar to the symptoms of GERD. What is an hiatal hernia? A hiatal hernia occurs when the upper part of the stomach pushes through an opening in the diaphragm and into the chest cavity. The diaphragm is the thin muscle wall that separate the chest cavity from the abdomen, and the opening in the diaphragm is where the esophagus and stomach join. Hiatal hernia can develop in people of all ages and both sexes, and now it frequently occurs in people aged 50 and older. Hiatal hernia occurs more often in people with overweight, obesity, and smokers. What causes the hiatal hernia? The most common causes of hiatal hernia is increase in pressure in the abdominal cavity. Your abdominal cavity is the space in the middle of your body that holds several organs, including the lower part of esophagus and stomach, small intestine, colon and rectum, liver, gallbladder, pancreas, and spleen, kidneys, and bladder. This pressure can build up from things like coughing, vomiting, straining during a bowel movement, heavy lifting, physical strain. There are also other reasons of hiatal hernia could develop. You may experience a hiatal hernia during pregnancy if you have an obesity or if there is an extra fluid in your abdomen. Increased pressure in the abdomen causes part of the stomach to push through the diaphragm and into the chest cavity. The symptoms might include gastroesophageal reflux disease, which occurs when digestive juices move up from the stomach back into the esophagus. Symptoms observed include heartburn, bitter or sour taste in the back of the throat, bloating or belching, discomfort or pain in the stomach or esophagus. Although there appears to be a link between the hiatal hernia and the GERD, and one condition does not seem to cause the other. Many other people have a hiatal hernia without having GERD, and others have GERD without having a hiatal hernia. Another symptom of hiatal hernia is the chest pain. Since chest pain can also be a symptom of heart attack, it's important to contact your healthcare provider or go to emergency room if you experience chest pain. How is hiatal hernia diagnosed? It may be diagnosed by the barium swallow involves drinking a special liquid, then taking X-rays to help see problems in the esophagus, such as swelling disorders in the stomach, such as ulcers and tumors, which also shows how big the hiatal hernia is, and if there is twisting of the stomach as a result of the hernia. Another test is endoscopic, which is a procedure in which the inside of the upper digestive system is viewed with an endoscope, a long inflexible instrument about half-inch in diameter. The esophageal manometry measures the strength and muscle coordination of the esophagus when you swallow, and the pH measures the acid levels in the stomach, esophagus, and helps determine which symptoms are related to the acid in the esophagus. Then gastric emptying studies examines how fast food leaves the stomach. Results from this test are especially important in patients who have nausea and vomiting, and there could be other causes of nausea and vomiting besides hiatal hernia. So, how is hiatal hernia treated? However, since some patients with hiatal hernia have symptoms of GERD, treatment starts with methods used to manage GERD. These include making such as lifestyle changes, maintaining a weight that is healthy for you, decreasing the portion of the sizes of meal, avoiding certain acidic foods. When is the surgery for hiatal hernia needed? If the portion of the stomach entering the esophagus is being squeezed so tightly that the blood supply is being cut off, you will need to have the surgery. Surgery may also be needed in people with hiatal hernia who have severe, long-lasting chronic esophageal reflux whose symptoms are not relieved by medical treatment, and the goal of the surgery is to correct the esophageal reflux by creating an improved wall mechanism at the bottom of the esophagus. The think of this valve as a swinging door. It opens to let food passes down into the stomach and then closes to keep the stomach content from going back up the esophagus. When this valve doesn't work correctly, your stomach content can go the wrong way and damage your esophagus. If untreated, chronic gastroesophageal reflux can cause complications such as esophagitis, inflammation, esophageal ulcers, bleeding or scarring of the esophagus, or Barrett esophagus. How the surgery is performed. Surgery for repairing hiatal hernia involves pulling the hiatal hernia back into the abdomen, improving the valve at the bottom of the esophagus, closing the hole in the diaphragm muscle. During surgery, your surgeon will wrap the part of the stomach called the fundus around the lower portion of the esophagus. This creates a permanently tight sphincter, the wall, so that the stomach content will not move back reflux into the esophagus. Called a fundoplication, there are two versions of the surgery. An open fundoplication surgery involves a larger incision. This type of procedure may need to be done in some very severe cases, and it allows for greater visibility during surgery. However, open surgery requires a longer recovery time in the hospital. In many cases, the surgeon will decide to use the laparoscopic approach instead. A laparoscopic surgery is done through the several small incisions instead of one big cut. This is considered a minimally invasive option, and the specific laparoscopic procedure used to repair hiatal hernias called the niacin fundoplication. This procedure creates a permanent solution to your hiatal hernia symptoms. During the procedure, your surgeon will make 5 or 6 tiny incisions in the abdomen. The laparoscope is a tool that allows the surgical team to see your internal organs on a screen in the operating room, and other surgical instruments are inserted. So the small incisions, and the fundus is wrapped around the esophagus, and the sphincter is tightened during surgery. The advantage of laparoscopic surgery compared to an open surgery includes smaller incision, less risk of infection, less pain and scarring, and a shorter recovery. A laparoscopic repair of hiatal hernia and reflux called niacin fundoplication is very effective in most patients, and this surgery requires general anesthesia and a short stay in the hospital. If you need to have an open surgery procedure, the recovery time will be longer and you may need to stay in hospital for several days after surgery. Most patients no longer require long-term treatment with prescription or over-the-counter antacid medications. And then we will come to the ventral hernia. The ventral hernia occurs along the vertical center of the abdominal wall. Symptoms include pain in the abdomen, especially when lifting or straining. Treatment is the surgery, including open, laparoscopic, and robotic hernia repair. The hernia occurs when there is a hole in the muscles of the abdominal wall, allowing a loop of intestine or abdominal tissue to push through the muscle layer. A ventral hernia is a hernia that occurs at any location along the midline, vertical center of the abdominal wall. There are three main types of ventral hernia. Epigastric hernia or stomach hernia occurs anywhere from just below the breastbone to the navel belly button. This type of hernia is seen in both men and women. Then is umbilical belly button hernia, occurs in the area of the belly button. And then is incisional hernia, develops at the site of a previous surgery. Up to one-third of the patients who have had abdominal surgery will develop an incision hernia at the site of their scar, and this type of hernia can occur any time from months to years after an abdominal surgery. What are the causes and risk factors for developing a ventral hernia? There are many causes, including weakness at the incision site of the previous abdominal surgery, which could result from an infection at the surgery site, or failed surgical repair match replacement. Weakness in an area of the abdominal wall that is present at birth, and weakness in the abdominal wall caused by conditions that put strain on the wall. These include being overweight, frequent coughing episodes, and severe vomiting, pregnancy, history of lifting or pushing heavy objects, straining while having a bowel movement, urinating, and injuries to the bowel area, lung diseases, chronic obstructive pulmonary disease, and emphysema. Struggling to breathe puts strain on the abdominal wall, and prostatism, enlargement of the prostate gland, which causes straining while urinating in older men. Older age, general loss of elasticity to the abdominal wall. What are the signs and symptoms of ventral hernia? Some patients do not feel any discomfort in the early stages of ventral hernia formation. Often the first sign is visible bulge under the skin in the abdomen or an area that is tender to touch. The bulge may flatten when lying down or pushing against it. The ventral hernia causes an increasing level of pain when a person lifts a heavy object, is trained to have a bowel movement or urinate, sits or stands for a long period of time. Severe abdominal pain can occur in part of the intestine, bulges through the abdominal wall and becomes trapped in the opening, and this happens when the trapped portion of the intestine becomes strangled, loses its blood supply, and starts to die or forms the gangrene. This is a medical emergency that requires immediate care. Your doctor will review a medical surgical history, or he will also perform a physical exam of the abdominal area where a ventral hernia may have occurred. Your doctor may then order imaging test of the abdomen to look for signs of ventral hernia. These tests might be including ultrasound, computed tomography scan, or magnetic resonance imaging MRI scans. Ventral hernias do not go away or get better on their own and require surgery to repair. In fact, without treatment, ventral hernias can get larger and worsen with time. Untreated hernias can become difficult to repair and can lead to serious complications such as strangulation of a portion of the intestine. The goal of ventral hernia surgery is to repair the whole defect in the abdominal wall so that the intestine and other abdominal tissue cannot bulge through the wall again. The surgery often restores the tone and shape of the abdominal wall by repairing the hole and bringing the muscle back to their normal position. There are three main types of hernia repair surgery: open, laparoscopic, and robotic. Open hernia repair incision is made in the abdomen where the hernia has occurred and the intestinal or abdominal tissue is pushed back into place. A mesh material is placed to reinforce this repair and reduce hernia recurrences. The skin is usually closed with dissolvable stitches and glue. Laparoscopic surgery: several small incisions are made away from where the hernia has occurred. A laparoscope is inserted through one of the openings to help guide the surgery. A surgical mesh material may be inserted to strengthen the weakened area in the abdominal wall. Advantage of this approach compared to open hernia repair include a lower risk of infection because smaller size incisions are used. And then is robotic hernia repair. Like laparoscopic surgery, robotic surgery uses laparoscope and is performed in the same manner as small incision and a tiny camera. Robotic surgery differs from laparoscopic surgery in that the surgeon is seated at a console in the operating room and handles the surgical instrument from the console. While robotic surgery can be used for some smaller hernias or weak areas, it can also be used to construct the abdominal wall. Other benefits of robotic hernia surgery are that the patient has tiny scars rather than one large incision scar, and there may be less pain after the surgery compared to the open surgery. Your surgeon will consider several factors to help determine the best surgical hernia repair method for you, including your age, existing health problems and medical history, the size of the hernia, the size and contour of the abdominal wall, amount of skin that can be used for the repair, and the presence of infection. Importantly, your hernia repairs are tailored to your specific situation based on the goals of the procedure and expected outcomes. So you can learn more about it. Then we will come to sport hernia, which is a term which is a misnomer since it's not actually hernia at all. It's a type of injury that commonly affects athletes, usually in lower abdominal groin, and these are common places to have hernia, and the injury may cause chronic pain similar to hernia, but there is no tissue protruding through other tissue. It's usually a tear in a tendon or muscle caused by sudden twisting movement. Hernias are common and most are not serious, but complications can occur. Pain and other problems become more likely as time goes on, and keep an eye on your hernias and see your healthcare provider before it becomes serious. Since hernias don't go away by themselves, you will likely need a procedure to fix it, and you will be in a good company, and there are many among the most common surgeries being performed worldwide. What are the risk factors that contribute to the hernia? A job that involves heavy lifting or many hours of standing might be a factor. A chronic cough or allergy that causes chronic sneezing might be a factor. Chronic constipation straining to poop or pee might be a factor. A history of abdominal or pelvic surgery might be a contributing factor. Pregnancy, especially repeated pregnancies, might be a factor. Chronic obesity and a body mass index or BMI greater than 30 might be risk factors. Your child may be more likely to be born with a congenital hernia if they are born prematurely, have cystic fibrosis, if he has a connective tissue disorder, or have a congenital hip dysplasia, or have undescended testes, or have other problems in their reproductive systems or urinary systems. So these are at more greater risk for developing the congenital hernia. What are the complications? In most cases, complications begin when a hernia gets stuck and cannot move back in incarnation. An incarnated hernia can become increasingly painful and dangerous, and if your bowel that is stuck, your bowel may develop an obstruction that makes it unable to pass food or gas. If incarcerated tissue does not have an access to blood supply, strangulation, it can lead to tissue death, necrosis or gangrene. Complications of diaphragmatic hernias are different. In general, organs that herniate through the diaphragm are not likely to get stuck. A hiatal hernia rarely causes complication except for chronic acid reflux. On the other hand, a congenital diaphragmatic hernia (CDH) is always complicated because it affects the way fetal organs develop. Babies born with congenital diaphragmatic hernia (CDH) are critically ill and will need intensive care. Any hernia pain is worth a visit to your healthcare provider. It is important to have a healthcare provider diagnose hernia pain since many other conditions can be mistaken for a hernia. If your hernia changes color, goes numb, or causes symptoms like fever, nausea, and vomiting, seek medical attention right away. A simple physical exam is enough to diagnose a hernia depending on the type. Your healthcare provider may be able to see or feel it, or it may be emerge when they ask you to cuff or adjust your position. They will check to see if they can physically reduce it, make it go back, is to determine how serious it is. Some hernias may require a form of soft tissue imaging such as CT scan to diagnose. Most hernias will need surgical repair, but most necessarily right away. And if you have a small or mild hernia that only comes out occasionally, your healthcare provider may take a wait and watch approach to see if it gets much worse. Hernias do tend to worsen over time, which is why providers recommend repairing them. With the exception of umbilical hernias in babies, they do not go away on their own. And uh, hernia repair surgery is common and generally a minor procedure. Unless there are complications, your surgeon will push the herniated tissue back into place and reinforce the barrier is pushed through with stitches or with surgical mesh. Surgeons can often use minimally invasive methods for routine repair. Hernia repair, which means smaller incision, less operative pain, and faster recovery. Then laparoscopic surgery uses a laparoscope, a long thin tube with a lighted camera on the end to look inside the surgical site. The laparoscope goes in one small hole and long thin surgical tools go through another, and then robotic surgery for repair of hernia is similar, but the surgeon controls the tools from a computer console using robotic arms. Some hernias may need traditional open surgery. A congenital umbilical hernia will often close on its own as your child grows, but sometimes it would not. In this case, your child will need umbilical hernia repair. A hiatal hernia often would not need repair, but it may if it causes chronic acid reflux. Your healthcare provider may recommend a niacin fundoplication to repair this problem. It involves wrapping the upper stomach around the lower esophagus and stitching them together. A small hernia may never bother you much, but hernias do tend to grow bigger over time. The opening continues to weaken and stretch, and more tissue gradually pushes its way through, and the more tissue pushes through, the more likely it is to become incarcerated, leading to pain and other complications. There is a small risk of general surgical complications such as excessive bleeding, wound infection, or reactions to anesthesia. Some people have difficulty urinating for a shorter period of time of surgery. About 10% of people report chronic groin pain after inguinal hernia repair, possibly due to nerve damage. And your healthcare provider will assess how severe it is and how fast it likely to progress. Some hernias may not need urgent repair, but for most, they will recommend it eventually. The surgery is usually a simple outpatient procedure with a short recovery. It's almost always successful, but there is a 10% chance of the hernia returning sometimes later, recurrence, especially in the condition that caused it to continue. You will have a hernia and are not having it repaired or not yet. You will want to try to prevent it from worsening. Your healthcare provider may advise you to adjust your habits or the nature of your work to avoid straining the hernia. In some cases, they might recommend wearing a special restraining belt to hold it in during certain activities. Pay attention to your symptoms and any chances you experience. So this was a helpful, informative discussion about hernias and about congenital hernias of hiatal hernias and the femoral hernias and inguinal hernias and their types. So I hope so that you would have liked this video, and if you have liked this video, then don't forget to subscribe my channel and share this video with other individuals as well. And thanks for listening and watching this video. and have a wonderful nice day. Thank you very much.